We now have 91 participants already. It's just 7.
All right. Greetings from Higher and Technical Institute, Mizoram, Hatem. Welcome everyone on this night of the international level webinar on issues and challenges among children, prospects and interventions. Before moving on to technical session, I would like to introduce Mr. Rosanglian Kiangte, who is Assistant Professor and Head Department of Social Work, Higher and Technical Institute, Mizoram Hatem, and he is the convener of this webinar. Also, Mr. Artbased, who is Assistant Professor, Department of Social Work, Higher and Technical Institute, Mizoram Hatem, and he is the organizing secretary of this webinar. And without them, this international webinar could not be completed. So we give thanks to Sir Ares and Sir Artbased for your hard working. Dear participants, please stay with us throughout the program and feel free to ask questions in the Q&A box, and our speaker will give an explanation at the end of the session. And the feedback form will be available in the chat box at the end of the program. I request all the participants to fill up the form, and you will receive your certificate as well. And moving on to the technical session, tonight we have illustrious speakers in our panel to talk on the topic. We are pleased to welcome Mr. Victor Alexander, who is an experienced worker with a demonstrated history of working in hospital and community mental health settings. And he has skills in counseling psychology, hospital discharge facilitation, resource counseling, case management, and crisis intervention with adults and children. He finished MPhil from National Institute of Mental Health and Neurosciences and had worked as mental health coordinator at Warden Woods Community Center, transition navigator at Michelle Guerin Hospital, crisis support worker at Canadian Mental Health Association, Peel Dufferin, and at present, he is care coordinator at Toronto Central Local Health Integration Network at Toronto, Canada. So without further ado, may I call our first speaker, Mr. Victor Alexander, to talk on intervention using art-based tools. Sir, please take your time.
Thank you very much. That was a pretty cool introduction. Thank you so much for that. All right, so let me share my screen. It still says the host disabled participant screen sharing. Is someone blocking me from sharing my screen?
Sir, please could you wait for a minute, please?
Sure, okay.
Um, Dear participants, please bear with us as we are having technical problem right now. So I ask for understanding. Please wait for us for a few minutes. Okay. Um, to the participants, the feedback form will be available in the chat box. This time, the feedback form will not be sent to you through your email, but it will be available in the chat box. So please check out and please fill up, and you will receive your certificate as well. Okay, sir. Sir,
I
can you
still
hear
have the
me?
same issue, not able to present my screen. What we could do is, I sent a copy of the PPT.
Sir, you can share now, please.
Okay, got it. All right, works. Thank you.
Okay. You're welcome, sir.
Can all of you look at my screen?
Yes, sir.
Yes?
Yes.
All right, okay, thank you. So respected professors, students, and participants, a very good evening to everybody. And I'm extremely happy to connect with all of you through this two-day international webinar. The topic I'm presenting on is interventions using art-based tools with children, of course. So in other words, it's arts-based interventions with children, okay? So the purpose behind my presentation is to introduce arts-based interventions with children in the practice of social work. Perhaps some of the students are already using some art-based interventions in your fieldwork settings, or some of you already attended some workshops or trainings on art-based tools or art-based therapy and things like that. So through this presentation, I want to add to your already existing knowledge and experience. So I want to start this presentation by highlighting the point that Indian culture is an artistic culture. You go to any part of the country, you go to any state in India, the state has its own art forms, dance forms, and we practice art in everyday life in our normal culture. So let's say that we have our own bedtime stories to tell children before going to bed, or we have our own songs as lullabies to sing to small babies, or we have our own songs for funerals, our own songs for festivals. So Indian culture is very artistic culture. So our people use these art mediums to express their traditional knowledge, to offer the traditional education in the traditional ways, and in many other ways. So art tools are not new to us. So it's a matter of how social workers like us can use these art mediums in the practice of social work. Art tools can be used in multiple ways. So that is what I'm going to be talking about during this presentation. And in the recent days, there is a growing evidence, research evidence for effectiveness of art-based interventions with children. So I'll be talking a little bit about that as well. So when we say art-based interventions or art mediums or art tools, we often just think about drawing and painting, but actually it contains a lot more. So usually I divide them into 4 different types of art interventions. The first one is creating with our hands. So those are art mediums in which we use our hands to create something new, to create something cool and beautiful. For example, pottery, craft works like greeting cards, jewelry making, things like that, drawing and painting, origami, and things like that. So the second type of art medium is acting with your bodies. So here we can talk about dance movements, dancing as a medium of healing, games where you sing or you move a lot in games. So in bracket I've written Play for Peace. So it's basically an organization. They have a set of games that they use with children. Also drumming. So these days, a lot of organizations use drumming, or they also call it drum circle. They use that medium with children. Another form of art is using our voices. So in the sessions, we use our voices in terms of storytelling, singing, and so on. And the fourth one is using both our body and mind. A good example would be meditation and yoga, where we will be sitting in a posture using our body. At the same time, we will be reciting something, or we'll be focusing on our body by using our mind. So there are certain activities we use both our body and mind. So these are different types of art mediums that we can use with children. So what is the process for art-based interventions? So the process for art-based intervention is very similar to the process for other interventions, other therapies. So we begin with a need assessment. So if you're working with, let's say, children, about 20 children in a community-based organization, in a small slum community, or in a disaster relief camp, we're working with 20 children, we would start with a need assessment. So what the children's psychosocial needs. And then based on that, we set up therapeutic goals. So we set up our therapeutic goals, and based on the therapeutic goals, we plan our interventions. So because today we're talking about art-based interventions, we would be planning art-based intervention tools. So let's say using pottery, using clay, or using drawing, or using theater. So we'd be planning how we can reach those therapeutic goals using art mediums. And then post-intervention, we measure the outcome. So it could be a survey, a group survey, or you one-to-one talking. You measure the outcome of your intervention. So it's a similar process. So what outcomes can we expect out of this art-based intervention? In other words, art-based therapy. A wide variety of outcomes can be achieved through art-based therapies. It could be as simple as just helping the children have some fun for the day, helping them get some recreation, and also enjoy a sense of well-being. Through art-based intervention, we can help children develop life skills. Then we can help children develop skills in arts and crafts. Sometimes it becomes a skill, and when children learn certain skills, it also becomes a source of confidence for them. Because they feel they know something, they're good at something, so it builds confidence in them. Through art-based mediums, you can also develop leadership skills and organizing skills. For example, sometimes you give a theme to children and ask the children to come up with particular drama or theater. So children discuss in a group within themselves, they can come up with something creative. So that gives them enough freedom and the space, to think, organize themselves, lead themselves, and come up with something creative. Through art-based mediums, we can also develop a we feeling among them and help them gain more confidence. We can help them achieve creativity and also help them express and ventilate what is deep within them. There is so much research evidence for art-based therapies all around the world. So I want to present a few. I didn't want to talk too much about this. So here we see art-based group therapy work was found beneficial for children in foster care. So in terms of learning new skills, improvement in coping abilities, and connecting with feelings. And overall, they felt more positive about themselves. Okay. So another research in 2007 says art-based art therapy interventions were very promising. A treatment, adjunctive treatment for adolescents with PTSD symptoms, post-traumatic stress disorder symptoms. So it's more of a clients with the deeper clinical issues. So another research in 2007 says art therapy has proven effective in decreasing internalizing behaviors. So here they mean is internalizing means people sometimes bring outside problems inside, and they don't talk about it. So they keep them inside. So through art-based therapy, they were able to decrease such behaviors for children with autism spectrum disorders. So another research in 2007 says trauma therapy program were very useful for immigrant and refugee adolescents in reducing the reported level of impairment due to emotional behavior problems. So it helped them with their emotional and behavioral problems. So where can art-based interventions be provided? It can be provided in a wide variety of places. So for example, art-based interventions can be provided in schools and in special schools. You understand special schools, I believe. Special schools are for schools for children with childhood disabilities and disorders like cerebral palsy, autism spectrum disorder, ADHD, mental retardation, and so on. Art-based interventions can be provided in community centers for children in the communities. So they can be brought into a community center, and then you can offer those interventions. Institutions like children's homes, remand homes, orphanages, and so on, I've myself been part of many programs, many art-based programs in such homes, children's homes, where children are often brought, they're found wandering on the streets, they're brought to these homes for rehabilitation. So they get to enjoy these art forms so much. Another place could be hospital and cancer centers. When we say a hospital, it's not by very posh hospital like Apollo hospitals like that. It's hospitals, they're like smaller hospitals or government hospitals where there are not too many staff to provide additional services. Often the children are just left like that. They get treatment, medications, and that's it. So often social workers or counselors take up activities in hospital and cancer centers with children. Another wonderful place where we can use art-based therapy is disaster relief centers and also post-disaster care for children. To give an example, I was part of a project for children who were victims of the Mumbai bomb blast event. They call it triple bomb blast in 2011. Some of the children witnessed other people getting killed during the bomb blast on the spot, and some of the children were affected by the bomb blast directly. Still, some of the children carry those shrapnels from the bomb blast in their bodies. So they continue to experience lots of disabilities, pain throughout their life. So the post-disaster care never stops. Even after disaster, children need a lot of services and help. Art-based tools can be very effective for certain therapeutic goals, even though they may need more help, like financial help, case management, counseling, and things like that. For adults, art-based therapy can be very effective in prisons, seniors' homes, mental health hospitals and rehabilitation centers, even corporate offices. I know many art-based therapists go to corporate offices. They conduct programs for corporate staff, to recover from stress and feel better about their workplace. Okay, in India, there are so many organizations that exclusively use art-based interventions. I particularly follow some of them on social media and LinkedIn. They do wonderful work with children. Their main mode of work is using art-based interventions. The first one I want to highlight is Kolkatas Work. They use dance movement therapy exclusively to work with children who are rescued from brothels. In other words, children and adolescents who are victims of sexual trafficking. And they also offer the same services in many children's homes, children who have difficult circumstances. Another organization I personally know is Snehadara Foundation in Bengaluru. They use art-based intervention exclusively to work with children with childhood disorders. And another one I know is Khula Asman Trust, Mumbai. I myself worked in this organization for about 4 or 5 months before I moved to Toronto. So on this slide, I want to talk a little more about Kolkatas Work's work. I'm a big fan of their organization. So as I said, they use dance movement therapy, dance as a medium for healing. So I personally found their model here. So children and adolescents who are going through stress often face distress and trauma, and they engage in negative coping styles, and then they experience failure of social systems and stigma. So they go through this extensive dance movement therapy. It often lasts for several months. May not be like every day, it could be like once a week or once in 2 weeks, like that. And they often find very positive results post intervention. So they observe positive mental health, or self-regulation, feeling of social support, and things like that. And which is an indication of well-being, individual well-being. I have their website here, so if you are interested, you could go through that. There are many organizations that offer small certificates. Could be for a few months or 6 months or 1 year. For example, the Tata Institute of Social Sciences offers I think it's a 6 months diploma in dance movement therapy. It's a part-time program. So you have in-class training, and you also do some field work, and then you get your certificate. Especially, you don't need to be a dancer to get this diploma in dance movement therapy. But if you were good at dancing, you will enjoy this program all the more. The World Center for Creative Learning Foundation, Pune, offers certificate in arts-based therapy. It's about a year. It's again part-time. People from all over the country come and do this program in Pune. I personally did this. It's quite famous, and it's an added skill for social workers when they complete this program. Similar programs are also offered by Mind and Arts Institute, Mumbai. It's a new organization that provides arts-based therapy. There may be many more organizations providing programs in art-based therapy or art-based interventions. Many organizations conduct 1 day or 2 day short certificate programs just to help their workers get a little more skilled, so that the workers can use art-based therapy or mediums, tools with children in the community. So I want to share some examples of art-based intervention in communities. Most of them are my own experience in the community. So I worked in a slum community in Mumbai. So you often don't get a lot of space to work with children in the communities. Sometimes you approach another community-based organization, ask for a small space once a week, probably during weekends, and then you get that. So you bring a few children first, and then they bring more children, and then you can really start a lot of art-based interventions with them. So here you can see that in a picture, we are having what they call drum circle. Drum circle is it's an art-based intervention. It's a tool. It was basically developed in other countries, in the US first, and then it became quite famous all around the world. It's a nice way of having fun, creating music together, singing together. And it often results in a lot of recreation. Children feel great about being part of this music program, a drum circle program. During one of my sessions, we conducted a small exercise. Children are often curious about tobacco, cigarettes, and alcohol and things like that. So we wanted the children to deal with their curiosity about tobacco in different ways. So we gave them cigarettes to create some art to art in a creative way. So just to teach them that tobacco doesn't need to be smoked used only for smoking purposes alone. It can be used for creative purposes like this. So the children came up with some creative art using the cigarettes. So it's very interesting to see that. It's a small exercise where children were asked to find role models among themselves. For example, because Islam children, you can often observe that they're all, they want to go after Salman Khan or Shah Rukh Khan, they are their heroes. So through this exercise, we wanted children to recognize the strengths of their own friends, their own family members in their own community. So they came up, they found someone in their own community. They are writing about the strengths in their what they call their own model. Because we are able to bring children together through this art-based interventions, they were able to do much more than what we could do in the smaller settings. So for example, we were able to help them put up a street theater in their street about tobacco prevention on the Tobacco Prevention Day. So they were able to put up a drama on the street for their community people to watch. These children were, through this art-based intervention, they were able to connect with each other. They were able to participate in many community programs. For example, you see on this picture, during this Ganpati festival, they were able to participate in a community program. They were able to win some competitions. This is a one-day workshop with children in an orphanage in Goa. So usually if it's a one-day intervention, in the morning we conduct a lot of games, very physically tiring activities in the morning. Then after the lunch, we do some smaller like art, drawing and painting exercises. So during this, one of these sessions, they were able to produce a beautiful piece of art. It is quite long. You can see it in the picture that it's called a group art. It has a certain technique. So people keep moving from one place to another, part of this group art. So they, in fact, their hand is everywhere on this picture. So they just contribute to the entire picture, and it often brings creativity in them. This is some work we did with children recovering from cancer at Tata Memorial Hospital. So as I said, sometimes in hospitals, children may get treatment, medication and things like that, but they're often left just like that. They don't have anything else to do. So it was actually organized by one of our fieldwork students doing MSW at Tata Institute. So I was asked to just conduct just a 1 to 2 hour program for them. So it's a clay modeling thing, some storytelling. So they were asked to work on a story and then bring it in a clay form. And then after that, they have to narrate the story. The children and the family members participated, and they thoroughly enjoyed the session here. And this work, some of these pictures were brought to the notice of staff at the Corporate Social Responsibility Program by Cadbury Chocolate. So the Cadbury Chocolate Corporate Social Responsibility staff decided to fund such art-based interventions in the hospital for a long time. So they in fact funded about 80,000 rupees for ongoing art-based interventions for these children. So the student and the staff were so happy about this funding that they received through this small activity. So by this, I mean, such activities can bring up many other possibilities. This is a picture that I had on my report long back. So in this, I say, this is a program I conducted for community workers in a small community in Mumbai. This is children who were brought from Dharavi slums. So they were brought to the Tata Institute, and we conducted a one-day program, art-based program. You can also see that some of community children were brought to Tata Institute in their classrooms for additional classroom type of discussions and things like that. So we did some art-based interventions with children in a school. It's like once a month or once in 3 weeks, like that. It sort of adds to their overall education. So during these interventions, we mainly target, we try and teach life skills through art-based interventions. This one is for adults, not for children. It's in a home called Beggar's Home in Mumbai. People who are found wandering on streets, they are brought, apprehended under the Beggary Prevention Act by the Mumbai police. They are brought to a place called Beggar's Home. So they are brought here for rehabilitation, but in fact, nothing happens here. They're just left like that. They only get their meals. So like outsiders, like not NGOs come in, they offer lots of programs. I worked with them. So in this picture, you can see someone, one of the residents there, enjoying some clay work. In this, you see some of the residents drew some pictures, and they use that picture as a medium for storytelling. So this picture contains some stories, step by step. So this person is in fact telling the stories to other residents there. You can also see how the residents drew pictures on the walls, making this place a little more vibrant and beautiful. This one is in a community where both parents and their children participate in art-based interventions. And this one is in another small village community. It's a church. So we conducted a one-day workshop for children. This one we conducted for community workers who work with family members and children. It's called Pattachitra. We evolved this particular activity based on real Pattachitra, which is an art form in West Bengal. I briefly want to show a video, maybe a minute. I know time is short for us. So let me just open this. I don't know if you're able to hear the sound. I'm stopping here. So basically, it's an art form in West Bengal. It's called Patachitra. So it's a scroll painting in which there are different. Story has been drawn on a picture in a picture format, in a painting format. So and the artist sings the entire story um, that is there in a painting form on the canvas. So using that art medium, so we developed a small intervention. Here on this slide, you can see that a group of workers, they're telling their stories in a very similar way in Patachitra. So on a chart, on a chart paper, they're telling their own, they've come up with a story that they created, or or something they experienced in their own organization. And then they drew that in smaller sections, 1, 2, 3, 4, 5. And then they try and sing that story in a song. So it's a very interesting activity, and the participants really enjoyed it. So through this, they're telling their stories from their communities, or they try and sing that out, and they're expressing their creativity. They thoroughly enjoyed it. So by this, I mean, often you don't need to just Google search for ideas, art ideas. We can use and we can evolve and improvise on our own cultural activities in India. So like this. So you can use your own cultural techniques with children as art interventions. Okay, yeah, a few things I wanted to tell you before I finish my presentation and get ready for a discussion. To facilitate or to be a participant in an art-based program, one doesn't need to be an artist. If you have the spirit, then that's good enough. There is some art in everybody. So everybody is recognized as an artist when it comes to art-based therapy. So one doesn't need to hesitate much if they are either participating or facilitating. Sometimes some training is useful for facilitation if you're a facilitator, like a social.
Oh, don't do like that.
Conducting in a community. If you go through some training, that's useful. But sometimes if you're creative enough, you can do it on your own. When you're doing art-based interventions with groups, it's ideal to have some group rules. With children, it can become a chaos if you don't have rules. Sometimes children can harm each other, beat up each other. Sometimes it can be a chaos. So always you make sure that you have group rules before you start the sessions. Art-based interventions work better along with talking therapies. So I told you that I was part of this post-disaster project for children who were affected by bomb blast. So we had one-to-one counseling sessions with children in the morning, and then we would have some art-based group sessions in the afternoon. So they were quite effective when they both occurred together. All right, so that's all I had to present. So here I want to congratulate all the staff and students at Hakim for completing your 10 years after starting this BSW program. Hearty congratulations. I wish you all the success in the future towards making it one of the best programs in the entire country. Thank you for this opportunity. So if you have questions, we can discuss for another 10-15 minutes.
Thank you, sir. Thank you, sir. It was magnificent and informative session. And there are a few questions here in the Q&A box for you, sir. Sir?
Yes, okay. So on
Okay.
the,
Okay, I'll read out and I request you to give an answer. Okay, sir. The first question is art-based intervention relevant regarding parents' role in the child's emotional development?
mm, it depends how therapists design their artwork or their interventions. Um, it can be effective if it is designed and executed well. Um, so there aren't any ready-made interventions, as there may be in some other therapies like cognitive behavior therapy. It may have its own model for certain mental illnesses like anxiety and depression. Cognitive behavior therapy's own model, it has its own exercises. They're all nice and clear. But in art-based therapy, you may need to design it on your own. So it depends upon individual therapists, how they design it, how they execute it to achieve that therapeutic goal of parent-children emotional effectiveness, whatever it is. But compared to other traditional therapies like art, like cognitive behavior therapy, art-based therapies are still gaining ground, not that famous. Still, they are in the developmental stage, art-based therapies. Sometimes they can be effective. Sometimes you may not be able to achieve it. In my opinion, I would say it is okay. The advantage of art-based therapy is that it's an expressive form of therapy, in the sense like it's not talking therapy. So it's very effective for children who are not able to talk or who do not want to talk about their issues. So the art-based therapies provide different mediums to express. So in nutshell, I would say it depends how the therapist plans and executes the intervention.
Thank you, sir. This is the second question for you, sir. According to you, will it be more effective to aware parents regarding art-based intervention for children's development?
Sorry, could you repeat that question? I couldn't hear you well.
Okay. Will it be more effective to aware parents regarding art-based intervention for children's development?
Sorry, the question is, let me just say how I understood the question. Will it be effective to make parents aware about the effectiveness of art-based interventions for children?
Yeah, yes, sir.
Is it? Okay. It's a quite complex question. All right. Well, I do not know if you need to make parents aware. It is, you can. It is good to make parents aware. For example, if parents are aware of the benefits of art-based interventions, then they will be willing to send their children to these programs, and they will be also able to participate in some of these programs if they are asked to participate. Especially for, I was talking about Snehadara Foundation, where they use art-based interventions with children with developmental issues. Here, the parents need to know that art-based interventions can be very effective for children with developmental delay. So only then they will be able to send them to those organizations or those schools. Otherwise, they would be sending them to any regular special schools. But anyway, even in any regular special schools, art-based interventions it's a must. I've done field placements in special schools. They exclusively use art-based interventions. They use a lot of props, lot of drawings for teaching, lot of tools, dolls, beads, like that. So because their goal is also to develop fine motor skills, gross motor skills, sensory skills, like that. So in fact, parents who are aware of the benefits of art-based interventions, they willingly bring their children to these schools, because they know that in such schools, the quality of education is always better. So that's my answer.
Okay, thank you, sir. And the next question is from Tanisha. She said, sir, could you please evaluate PTSD symptom, post-traumatic stress disorder?
Post-traumatic stress disorder is a clinical disorder. It can be for children, it can be for adults. Anybody can go through post-traumatic disorder. What is important in post-traumatic disorder is there is a trauma. For example, a child was severely beaten up by their parents who are alcoholic, or some issues, or a child witnessed a trauma, like father is beating the mother thoroughly and the child was standing there and witnessing. So those could be causes of PTSD disorder. So usually children will often, children with PTSD will often remember again and again those traumatic events they witnessed or they experienced. It sort of adds to dysfunctioning. They are not able to cope with them. They often engage in a negative coping skills like crying, isolating themselves from others, and things like that. Domestic violence. So I think Tessie is going to speak about domestic violence. That topic is very much related to PTSD. Again, since we are talking about art-based therapies, art-based therapies can be very effective for PTSD, children going through PTSD. As I said, along with other therapies like cognitive behavior therapy or cognitive behavior, CBT, particularly designed for children with PTSD. So along with those therapies, art-based therapies can be provided and can be very effective.
Okay, thank you, sir. There are more questions for you, sir, but this will be your last question since we do not have much time. And the question is, what will be the best interventions for children who are physically disabled?
I see, that's a good question. Since, even though they have physical disability, sometimes it doesn't prevent them from carrying out certain activities. For example, if children with cerebral palsy not able to walk, they can still dance using their hands. You don't need to just stand and dance. One can dance from sitting on the chair itself. So the world is the limit, sky is the limit. People can go to any extent of creativity. So art, you can use all those art forms like pottery, drawing and painting, drumming, dancing, dance movements. You can do anything with these children. You have to make sure that it's safe for them. and it's not uncomfortable for them. For example, a child who is not able to stand up, so you cannot be asking them to stand up and dance. The person can dance from a chair. So you make it, what is that? You customize the activities according to children's abilities, um, and still make it uh, nice and pleasurable activity for them.
Okay, thank you, sir, for your answers. Thank you so much. And now we will welcome our next speaker, Miss Desi Lalduzwali. Okay. Ms. Desi is a social worker at Harrow Council, London Borough of Harrow, United Kingdom at present, and she had finished MPhil from NIMHANS, Bangalore, India, and joined Integrated Child Protection Service as a counselor and worked as lecturer in Bosco Institute, Jorhat, and assistant professor at ICFI, Mizoram. And she had presented papers in national seminars and was invited to speak as a resource person on multiple occasions. And now we will call upon our speaker, Ms. Desi, to talk on impact of domestic violence among children. I ask all the participants to stay alert and give your full attention to our speaker.
Okay, good evening, everyone. I am really humbled to continue my presentation after Victor. That was a very brilliant presentation and very insightful for me, especially I do a lot of direct work with children every day in my work, and art therapy is one of the most important tools that I use in my dealing with children. Thank you, Victor, for your brilliant presentation, and thank you, Sai, for your introduction. And I would also like to thank the organizer for inviting me to speak on the topic impact of domestic violence on children. I just need a little bit of assistance. SAR, RTC, what happened with my slide, my PPT. I just have one question. Can I control it from my own, or you have to control it for me? You have to do it for me.
Miss
Yeah.
Desi, you need to say next slide if you want to move on to the next. So we will control it for you from here. Is it okay for you?
Yeah, that's fine for me. Okay, if you can go to the next slide. Yeah. So the reason why I am also interested in choosing this topic is because it's a very relevant topic today with the current situation that we are in. I have seen so many families, or I have seen so many stories or reports that during the global pandemic, or while the country is in lockdown, the rate of domestic violence have increased, especially it has impact on the children that we are working with. And children, they are they have the right for their voices to be heard. And it is also the responsibility of adults or the carer or the parents to see that the environment that they are living is safe for them. And that is also one of the reasons why it is such an interesting topic. Can I go to the next slide, please? Like I have said before, with the current situation we are in, the rate of domestic violence is increasing every day. The London School of Economic blogged reported that in the UK each year the Metropolitan Police Service received 2.5 million calls for service. Out of 1,700 are related to 7% are related to the domestic abuse. In the 11 weeks from the beginning of the lockdown, there were a total of 45,000 calls to the metropolitan service centers related to the domestic abuse, and 1,955 domestic abuse offenses recorded. In India, in June, in June 2020, the National Commission for Women registered an increase of at least 2.5 times in domestic violence complaints in the nationwide lockdown, and and also between 25th March and 31st May, the NCW received 1,477 after they launched their WhatsApp helpline. Um, like I've said before, there are also several reports, incident. One of the presentation done by Dr. Kim Vai on a woman and mental health during the COVID lockdown also presented several case vignette, which stated that so many of her clients come to her speaking about their experiences in their domestic household. One of the things that have been mentioned to her from her client is that one of her clients stated that her husband is a daily wage earner, and due to the lockdown he is unemployed and he does not have enough money to buy alcohol. So as a result of his frustration, he used to beat her and her children every day. And another example also stated that due to lockdown, like her husband is again out of job, and he used to demand a lot of physical relationship from her, and when she denies it, he used to beat her. So likewise, we have seen so many examples or incident reported all over the country, even in the UK. Can we go to the next slide, please? Next, yeah. I just want to touch a brief base on the definition of domestic violence. What is the meaning of domestic violence? Domestic violence is quite a relevant topic and important topic. So I believe that like we all understand the meaning of it. So the Prevention of Women from Domestic Violence Act 2005 defines domestic violence that any act, omission, or commission or conduct of the respondent shall constitute domestic violence in case if it harms or injures or dangers the health, safety, life, limb, or well-being, whether mental or physical, of the aggrieved person, or tends to do so, and includes physical abuse, sexual abuse, verbal and emotional abuse, or economic abuse, or it harasses, harms, injures, or endangers the aggrieved person to coerce her or any other person related to her to meet any unlawful demand for any dowry or other property or valuable or security, or otherwise injures or causes harm, whether physical or mental, to the aggrieved person. Or in terms of a simple definition, domestic violence is a threatening behavior, violence, or abuse between adults who are relative partners or ex-partners, it can also include abuse from adult to children or from parents of adult to children. It is a breach of human right as well as a major public health and clinical problem. Next slide, please. There there can be different concepts of domestic violence. I won't touch much on it. We know the different types of domestic abuse. We know that there is a power wheel control. We also know that there is a cycle of abuse. There are so many things that can be discussed. However, I will focus on my main topic, which is related to children. So if you come to the next slide, please. Um, when we talk about children experiences of domestic abuse or domestic violence, we mainly mean that children who are exposed or who witness the domestic violence incident between their parents. It can be between their parents, or it can be between the uncle, between the father or the sister. It can be between the maternal grandmother or maternal grandfather. So they might be witness to different incident. However, with regards to whether it is their parents or whether it's the other family members, still it has it can have a lot of impact and negativity in their lives. The I have put several research evidence which stated that our children may not always observe the violence, but they are still aware that the abuse is happening, which has been highlighted by Overland and Hayden or Swanston et al. To the 2014. Even though children did not or do not witness or the parents have not abused them directly, still there can be a lot of impact on them. Because think about your relationship with your partner, or think about aftermath of the fight. Still there can be a lot of tension in the family environment, and again, which in turn can have an impact on the development of the child. The research conducted with children also highlighted that their awareness of the abuse is greater than their parents acknowledge. Children are neither untouched by the violence nor passive bystanders, even though, like I have explained the previous one, even though children might not witness the incident directly, they can still feel and sense that their parents are fighting and it is not right. Like, for example, um, I have a child where the parents fight frequently, and I did not ask directly my child that were there any form of abuse or violence in their family environment. But what he told was that, like, he told me directly that I was in the bedroom, and then like my parents were fighting in the living room. And when I asked about the parents, they were saying that like they did not know that like the children were in the next room, means like the bedroom. So likewise, children can sense what happened in the family. Next slide. Children who lived in households where their mothers are abused by partners or ex-partners are significantly affected and experience considerable distress. That we all know. There is a clear and irrefutable link between presence of domestic violence and child maltreatment. There is an impact on parenting abilities. It jeopardizes a child's developmental progress and personal abilities, contributing to cycle of adversity, and it disrupts the broader family functioning and the how home environment. Later on, we will talk about the impact, how it directly impacts. So obviously, from what I have experienced every day, these are quite significantly true with the things that I've been experienced. Can you go to the next slide, please? It is accepted that children living with domestic violence are also at greater risk of experiencing neglect, physical and sexual abuse. We talk a lot about child abuse. We talk a lot about neglect, sexual abuse, physical abuse. If we look at the root causes, the main causes can be the main precipitating factors or the causes can be domestic violence. The NSPCC prevalence study found that young people experiencing family violence were between 2.98 and 4.4, 2.9 and 4.4 times more likely to experience physical violence and neglect from a caregiver than those young people not exposed to family violence. Kitzman have stated that at the most basic level, living in an emotionally charged and violent household has negative implications for children's emotional and mental health in both the immediate and longer term. We can talk about that later on. Devani has also suggested that there is a need for professionals to identify ways to effectively work with perpetrators without increasing the risk to victims. Can we go to the next slide, please? Um, Stanley stated that significant majority of children exposed to domestic violence are affected by the experience in both immediate and longer term. Kisman stated that a series of meta-analysis of research studies examining the effects of children experience domestic violence have indicated that exposure is related to a range of subsequent emotional, behavioral, and social problems. The pathway to is a complicated one involving children's reaction to what they have seen and heard, the decrease in the parental warmth and caring in household where violence takes place, and the protective factors that ameliorate some of the negative effects. Other research have also shown that children as young as 1 year old can manifest heightened distress in response to verbal conflicts between the parents. Um, like I said, like even though children have not exposed the DV directly from their parents, it can have a lot of impact on their developmental milestone. Like for example, one of the young child that I was working with, he was I think he was only like 8 to 9 months, and he what I can what how can I describe him, like he does not socialize at all, and even when other even when we try to play with him, or even we try to build the relationship or whatever it takes, like he socially distanced from us, from everyone, and he hardly smile or he hardly interact with his own body, or he does not show any positive body language. So even a 1 year old child can manifest heightened distress in response to the verbal conflicts between the parents. Next slide, please. Children living with domestic violence generally have significantly more behavioral and emotional problems than their peers who do not live with domestic violence. Research indicates that the impact of domestic violence on boys and girls is similar with regards to internalizing behaviors, but both boys are more likely to display externalizing behaviors. One of the family that I am working with, there are 3 children, sorry. The elder one is 16 year old and the younger one is 14 years old, and the youngest is, I think she is around 9. And there is a lot of significant domestic violence between their parents. So the way the girl child internalized the behavior is entirely different from the way the boy child internalized it. So the elder child has a lot of self-harming tendencies, and also a little bit of antisocial behavior, whereas the boy child has a lot of um, difficulty in controlling his emotions, or he is physically violent, and he is not able to express his feelings at all. So the impact of domestic violence on boys and girls um, can be similar or dissimilar. The older children are more likely to show the effect of disruption in their lives through performance at school, poorly developed social network, like I said, self-harm, running away, and engagement in antisocial behavior. Um, However, there are also evidence that children who are exposed to domestic violence appear to suffer from poor outcomes in their academic achievement. Can I go to the next slide, please? Um, there can be developmental perspective on the consequence of living with domestic violence. There are a number of theories that seek to explain why children's exposure to domestic violence is likely to adverse their development. Attachment theory states that within close relationship, young children develop mental representation or working models of their own worthiness based upon people's availability and their willingness to provide care and protection. A child reaction starts when the child manifests this poor attachment through their behavior, further challenging parents who are already struggle to cope with their own emotions and need for safety. There is an emerging evidence that young children who have witnessed domestic violence score lower on cognitive measures, even when controlling for mother's IQ, child's weight at birth, birth complications, the quality of intellectual stimulation at home, and gender. Exposure to domestic violence, particularly in the first 2 years of life, appears to be harmful. Like one of the child that I am working with, his mother has significant partners. So she has um, multiple partners. Let's say she has multiple partners where she experienced domestic violence from all of her partners, and the child, he manifests on himself and he is not able to achieve properly on his academic performance. So there are a lot of evidence which stated that the impact of DV on children is quite high and also dispersed. Can I go to the next slide, please? Children who experience toxic stress in early childhood may develop a lifetime of greater susceptibility to stress-related physical illness such as cardiovascular disease, hypertension, and diabetes, as well as mental health problems such as depression, anxiety disorders, and substance abuse. This can also be seen with so many of the child that I am working with. One of my child suffers from anxiety disorder as well as like depression, so it can be evidenced and seen. They are also more likely to exhibit health damaging behaviors such as smoking and adult lifestyles such as drug taking that undermine well-being and subsequently lead to earlier death. So what I want to add is that even though the domestic violence is historical, it's um, it's still very much impact on their current life cycle. So even if the DV incident happens like 5 years ago, still after 5 years, we can see a lot of impact it has on our young person, especially with regards to the antisocial behavior. Next slide, please. Again, here is the research evidence which support working with children. Stanley has stated that while we have increasing knowledge about the risk and protective factors in children exposed to domestic violence, there is less knowledge to increase their resilience. We practitioners, or I say we practitioners or professionals, we especially in the realm of child protection, we tend to focus our work on the children lived experience. There is the children lived experience, and sometimes we do not have that much knowledge to increase their resilience. So it depends on a day-to-day life or the experience that they have been through, and and the evidence that it has an impact on their behavior. Molander also suggested that whether a child needs protection service or not, research indicated all children living with domestic violence or its aftermath can benefit from individual and group work to help them understand or overcome the negative impact in their lives. So whether the child needs a child protection plan or not, if he is being exposed or witness the DV, the child can benefit from individual work or group work to overcome the negative events that he has faced. McConnell stated that the most important thing is to work with father who perpetrated the violence to reduce the risk and to prevent from further incident. Stanley et al. 2009 stated that children are best supported by professionals, and professionals should work together, whether it's a social worker or whether it's a school or whether it's a nurse or the health team. Um, if we understand our roles and boundaries in providing support to the children, then the children can retain their normal lives. And Stern and Poole also suggested that schools plays a major important role in identifying children who have been exposed to DV or children who experience trauma in their life. Here in the child protection services, we received our referrals mostly from the school, as well from the health. Can I go to the next slide, please? Yeah, my next slide is direct work with children. So as a like I said, as a practitioners, the first thing I need to do is I need to assess whether the child is safe, whether he is with his parents or whether he is with his extended family members. I need to assess where the incident has happened and whether it is safe for the child to live in that family environment any longer. So first, what I used to do in my work with the children is I ascertain that whether that place is safe, and also we do a lot of direct work with them. So this is one of the activity that I used to do. It is based on the Gestalt therapy. It focuses on the feelings of the child, to explore their wishes or to explore their feelings or to explore the trauma that they have been exposed to. Can we go to the next slide? One of the activity that I use is guided fantasy. Here I used to ask my child to think about all the positive things in his life, basically, or to think about what is his dream or make believe play or make believe trip, so that he can look what so that he can look the positive things in his life, not only focusing on the negative things. And also with regards to the hide and seek feelings, I used to put I use feeling cards in my work with the children, and then I used to hide it and then ask them to search. And then when they found the feelings card, I asked them to express um, I asked them to complete that sentence or express how they are feeling. So these are the activity that I used to use in my direct work with children. And most of the activity that I use, it's been taken from the cognitive behavioral therapy. So apart from that, like there are also so many activities that I took out, like for example, reflective listening, or reframing or positive affirmation, positive appraisal, so that so that we can explore whether the children are safe in their household, or to express their feelings and to express their feelings or anger. One of the things that I want to touch again is the impact that it the impact that domestic violence on the children, in terms of emotional impact. They might be feeling guilty, or they might blame themselves. They might grieve for the family, or they might grieve for the personal losses. And sometimes there tend to be a lot of confusion about um, confusion and conflicting feelings towards their parents, because sometimes children have been used as a scapegoat, or sometimes children have been used as mediator between their mother or father. So sometimes there tend to be a lot of confusion and conflicting feelings, whether they tend to be um, faithful to their mother, or whether they tend to be more faithful to their father. There can be a lot of like emotional impact on them. There can also be a fear of abandonment, a fear of rejection, or there can be a lot of um, personal injury, for example, in terms of self-harming behavior. Or there can be they might be feeling depressed, or they might have feelings of helplessness or powerlessness. And also they might be embarrassed by the presence of the family dynamics in the home, or in their own family environment. In terms of the research evidence, the research articles that I have provided previously also touch base some of the things that I'm about to say. In terms of their cognitive impact, sometimes they tend to blame others for their own behavior. Sometimes they believe that it is acceptable to hate behavior. So sometimes they also used to copy or model the perpetrators or the abuser, and they feel that it is okay to hit other, or it is okay to physically abuse others. Like for example, I have one child. um, she is 13 years old, and yesterday I met her yesterday, and she told me that like I was so angry, and then like I just hit my friend. And she so when I explore her further, it seems that like her father used to physically abuse her mother. So that means she is modeling her father's behavior. So that tends to happen with children as well. And they also have a low self-concept within the family. They do not um, what to say, they do not um, mind of the family rituals, or they do not mind of the whole family. They just lived on their own, and they sometimes they tend to normalize their family situation and think that what they are doing is right. Some they have difficulty in trusting other people, and sometimes they think that like being angry is um, good, because being angry is good, and that hurting other people is good. So that can be one of the cognitive impact that it can have. It can That is one of the cognitive impact that can happen on the children. And in terms of their behavioral issue, there can be a lot of behavioral problems um, if we take it into the behavioral disorders. There are the ODD, opposition. ODD is very common. ADHD is very common, and they tend to act out or withdraw. So either they are underachiever, or overachiever. They have school refusal. They run away. They are more concerned of themselves, and they tend to be selfish, and sometimes they tend to be aggressive or passive, and sometimes that it can also they also have bedwettings or nightmares, or they also have this aggression towards their parents. In terms of the social impact, they feel they are isolated from their parents, or they are isolated from their family members, and their relationships are frequently stormy and also end up abruptly. They have difficulty in trusting adults. They have poor anger management, and they have poor problem solving skills. They have excessive social environment, social involvement outside the family home, which tends to leads to antisocial behavior, and they might be engaging in and they might be engaging exploitative relationship. So that can also be the impact of the impact that it that that are the impact that can be seen with the behaviors of the children. Can I go to the next slide, please? Um, in order to reduce the risk, working with the perpetrators is one of the most important um, factor to safeguard children. Um, However, questions are now being asked whether the interventions currently being used with perpetrators of domestic violence are effective as a means of reducing repeat re-victimization. McGinn et al. Suggests that effective work with perpetrators of domestic violence must be built upon a better understanding of how and they want to change their behavior. As such, professionals and their employing agencies need to have a clear process and tools for assessing and managing the risk that is associated with domestic violence. One of the challenging that we professionals face is working with perpetrators because they do not want to accept their behavior, they normalize it, and they do not have any tendency for changing their behavior, again, which increases um, the risk of their children in their family environment. Sometimes we tend to separate the parent until proper work has been done with the perpetrators, but working with perpetrators is one of the most challenging that we face in our profession. um, can I go to the next slide, please? Um, this is one of the models that we use in working with perpetrators. Like I said, it is quite challenging as they do not want to seek help. They do not want to accept that what they have done or their behavior is wrong, and these are the um, steps which is being created by some organizations. I put their names at the end of the slide. So there are several steps in order to work with this perpetrator. The first one is preparing for the changing behavior, and the second session will include understanding the signal, understanding what is time out, when do they need to use time out, what do you mean by time out, and then the next step focuses on getting to know them. Sometimes it is important to know ourselves, our limitation, and the next one is family tree and support network, and the next step is introduction to thoughts, feelings, and behavior, positive self-talk and alternative behavior, alternative role play, understanding why people abuse, and then providing an insight into minimization, denial, and blame. Can I go to the next slide? And exploring parenting, because sometimes they need to be taught the parenting strategies or positive parenting. And sometimes we also need to make them understand the other forms of abuse like threats, intimidation, or harassment. What is emotional abuse? How are we going to build their empathy? And what changes do we need to make? How are we going to maintain these changes? And we also use techniques like role play, jealous, empathy, role play. And we also have more insight session into jealousy, intimacy, and respect, and taking part of an incident or violence or abuse. And at the end is the review and close. This has been proposed by this person, Kate, Iwi, Chris, Moira, Rory, and Monica. And it depends on the practitioners, the different steps that we use. Sometimes we might not use the whole techniques, all these techniques. So it depends on the need of the client and the level of their violence behavior or the level of their insight. But these are the things that we use when we are working with perpetrators. um, with that, I conclude my presentation. I hope it's useful. There are so many things that can be included in this presentation, but what I want to share is the work that we do mainly in the realm of the Child Protection Service. Thank you.
Okay, thank you, Miss Desi. That was informative session. There are some questions on the session. I request Miss to give an answer for the participants. This is the first question for you, Miss. Is there an increasing rate of domestic violence which affects the family structure during this pandemic COVID-19?
um like I have like I've explained in the beginning, obviously there is an increase of DV incident during the global pandemic. I where we have seen in the UK, as well as in India, which has been reported by the study from NIMHANS. And I can also share what I have experienced in the UK, like the statistics that I have put on my PPT. I can say that like there is a high increase of DV incident because of the global pandemic. I hope that answer your question. Sorry.
Okay, thank you, Miss. Moving on to the next question. Is there any difference on the frequency and nature of domestic violence between the rich and the poor?
Um, one of the difficulty that we have in UK, one of the difficulty that we have or we have seen in UK is what I have seen or from my own experience is that we do not get much referrals from the um, what will I say, like rich people or the upper class people. We used to discuss among our colleagues that so I work in Harrow, which is a London suburb, and there are so many other other local authorities where like businessmen or the upper classes lives. So we have been discussing, and they have less cases as compared to um, us, as compared to the London borough of Harrow, because we live in a suburban where most of our families are middle class families. And also it has a lot to do with our culture or our ethnicity. I can say that the prevalence of domestic violence is very high among Asian cultures rather than the white, or whether than the British ethnicity or the white. So there is a disparity between the upper class and the lower income or like middle class.
Okay, thank you, Miss. And the next question is from Fanny Liza. According to you, ma'am, what is the main thing or main intervention that you do to help domestic violence or stop it?
Um, as far as from my own experience, I mainly focus on women empowerment, because, like I said, working with perpetrators is one of the most challenging things that I have faced. It takes a lot of patience. It takes a lot of grit to change the perpetrator's behavior. So I mainly focus on empowering women to be able to take care of themselves, or to be able to be the main primary carer for their children. So my main focus is on women empowerment, and obviously, yeah, children cannot be neglected. But apart from the children, I work with um, the victims mainly.
All right. The next question is from Sengbat Marak. And he said, ma'am, what is the most commonly used defense mechanism used by the children?
The most defense mechanism used by children, I can say, like, again from my own experience, displacement. I think, like Victor also has said, that like children have difficulty in expressing their own feelings and emotions. That's why we use a lot of art therapy, or that's why we use a lot of creative direct work. um the displacement is what I have seen the most. Like, for example, one of my child, he knows that he's a 13-year-old guy, and he knows that like something is not right in the family, and he does not want to tell his mother directly, or he does not know. It's not that like he does not want to tell his parents directly, he just does not know how to express himself. So he used a lot of tantrums, he used a lot of violent behavior. So displacement is one of the most common that I have seen.
Okay. And the next question is from Marbabiang. And the question is, does children who grows up in a family with cases of domestic violence have high chances of becoming perpetrators of domestic violence in the future?
um yeah, research evidence has stated that children who witness or who are exposed to DV have a high chance of becoming perpetrators in when they grow up. And there is also a research evidence which stated that children who have alcoholic parents are tend to be alcoholics themselves when they grow up. So there are research evidence to be seen, but I do not. Sorry, I do not know the authors.
Okay, thank you. And the next question is, Miss, in regards to your opinion, which one caused the most challenges among children or youth, the parents or peer group or the society?
Can you come again? Sorry.
Okay, which one caused the
Mm.
most challenges among children or youth, the parents or peer group or the society? And please tell us the reasons. That is the question for you, Miss.
That's quite interesting and difficult question. Um I can say all. And whenever we work with children, whenever we work with youth, whenever we work with parents, we tend to use a holistic approach as well as a strength based approach. So all of them are challenging in their own way, and we try to work with them as effective as possible with our multidisciplinary team. So I don't know which one to specify. I hope that
Okay.
answer your question.
Okay, thank you. And Miss, this will be the last question for you. And can you suggest one or two points to intervent challenges of mental abuse caused by physical abuse for oneself to overcome?
Can you repeat again? Sorry. Can
Okay.
you suggest?
One or two points to intervent challenges of mental abuse caused by physical abuse for oneself to overcome.
Oneself to overcome. Um, Apart, it is always important to speak to professionals and seek professionals guidance. However, if you are not able to do that, what I can suggest is have thought diary. So having a diary to express your feelings and emotions is really really effective. I can suggest that. And apart from that, form a positive support network. What When I say positive support network, that means those who understand you, those whom you trusted, or those who are close with. So when I say positive support network, that does not necessarily mean your sister or your brother or your parents. So the person you trusted the most can be your friends or your peer group. So I could suggest that one, thought diary, as well. The other one will be positive network group.
Thank you so much, Mace, for your answers. And there is a common question for you, Miss, and Mr. Victor. Uh, Mr. Victor, are you here with us? Can you please answer this question for us?
Mhm.
Okay.
Yes, go ahead. What is the
Okay. All right. This is the question. What could be the role of adults in response to the challenges and issues among children?
Well, it's a very broad question. If not the adults, who else will stand for the children? Um, and then again, when we say adults, uh, there are different types of adults, right? Adults, social workers as adults, parents as adults, community members as adults, and so on. So there are different players, adult players, teachers in school, um, uh, religious people in churches. There are so many institutions. All their roles differ from each other. As a social worker, my role is to advocate for those policies that protect children in their homes, in their communities, in schools, and so on. And no matter how much services we have for children, they are not sufficient. No matter where they are, whether they are in India, in Canada, UK, service is not sufficient. So social workers all over the world advocate for more services for children, counseling, community educational services, and so on. Uh, so that's what I would say for that question.
Okay, thank you. Miss Tessie, do you have anything to say?
I second Victor. That is a very broad question. Um, for me, after working with so many families, what I have found out, or what I would like to say, is that it is very important to have a strong family values and a strong family values and support network. If people, like in India, we are lucky that we have such a good family values and support system. If the family values and the support system is good as in other countries, I think that like we can reduce so many of the social problems that we are facing now. And as a social worker, yeah, it is my role to advocate for the families that I am working with, whether they are child, young person, adults, or whatever problems that they have, whether it's disability, mental illness, or anything. It is my role to advocate for them, and I am happy to do that. I think that's my question answer. Sorry.
Okay, thank you so much for to both of you. And Mr. Victor, there are two more questions for you. So can you please answer for that? Okay, all right. Thank you. The first question is from Emmanuel, and can music be used as art-based intervention tools? Looking at the muso context, music plays a very important role in the socio-cultural life. How far is music practicable as an art-based intervention tool?
I see. It's a good question. You are basing that question on your own cultural activity. I'm glad. Um, I'm not an expert in music therapy per se, even though I personally seen music therapy being conducted for clients and researchers done. They were found very effective for children. Mm, so as I said, I'm not an expert, so I don't have too much to say about it. Uh, I live in Canada and I work with adults and seniors. Music therapy has so much evidence that music therapy has been used for seniors with dementia very popularly in Toronto. Um, and it's used by some of the most popular organizations here. There's an organization called Alzheimer's Society of Toronto. Um, they're quite famous here, and they use something called iPad therapy. So all those seniors with Alzheimer's disease who are part of the program, they get an iPad where they, in which through which they are asked to listen to some songs that they've songs or music that they have identified um, as effective. So it's definitely it's a good opportunity for you to explore more on music therapy since you showed interest on that.
Okay, thank you. And here is the next question and the last question for you. Um, Sir, from your presentation tonight, I came to learn that uh, art art-based tools intervention is very effective tool and useful approach in many ways, especially when working with children in various systems. What art-based tools will be used by social workers to help school children who are being affected by COVID-19 pandemic, where they have to spend most of their times at their home, while these art-based tools mostly demand face-to-face activities and social distancing is need to be maintained also.
Wow, that's a great question. um, well, it depends. I mean, the pandemic has definitely brought a lot of challenges for both adults and children. So when we are providing interventions, one of the important things um, we need to do is help the children recognize the impact that the pandemic has brought and help the children acknowledge the distress and the challenges that has brought to them, and also help the children to cope with them effectively. So since we are not able to do face-to-face group sessions under one roof, many things can be achieved through um, webinars or internet-based interventions. Well, since it's a new scenario, so we need to get creative here and plan intervention in such a way that the children are able to um, engage in art-based interventions in such a way that these interventions are effective for them. Um, while they are going to so much difficulties and distress. For example, let's say we conduct a program today over the internet. So everybody is present on video call. Then you can sort of conduct some programs and exercises. It could be drawing that they do and then show it, or they start as some sort of storytelling, or they can talk about their own distress, and they can talk about some artworks they did, and things like that. People can get very creative on this. Since this is a new thing, all of us have to sort of plan and explore how we can work with these children.
Okay, thank you, sir. Thank you for your answers. And I hope we learn lessons from our session, and with the input of our speakers, I believe our knowledge is largely enriched. We are now coming towards the concluding part of our international level webinar. I now invite Mr. Rosang Lianakyangte, who is Assistant Professor and Head Department of Social Work, Higher and Technical Institute, Mizoram, Hatem, to present vote of thanks.
Thank you, Chair. Thank you so much. Hello, good evening, everyone, once again. First of all, on behalf of the organizing board of these 2 days webinar, like to propose heartily vote of thanks. Let me start with our Honorable Vice Chancellor, Mizoram University, Professor A.R.S. Sambhavasi Rao, for gracing our webinar and thought-provoking address. And Professor Kanagaras Iswaran, Head Department of Social Work, Mizoram University, and we thank you for accepting our request and supporting as our parent department. Then we would like to express our profound gratitude to our distinguished speakers of the first day, the first night, Professor Musbinder Hope Lee, Madam, Jamia Millia Islamic University, New Delhi, and Dr. Henry Zagiliana Atsulong, who is also the co-convener of this webinar. We were indeed very humble to approach you, and thank you, Madam Popley and Sir Henry, for accepting our humble request to be our resource person. And it is a great honor for us that you spare your valuable time with us. And even though you have a very busy schedule in your profession, you've been fortunate and blessed. And we thank you so much to both of you, Madam Popley and Sir Henry. So we are immensely thanks to Mr. Victor Alexander, the coordinator of Toronto, Central Local Health Integration Network, Canada, and of course, Mr. Sheila Zoli from Borough Council, London Borough of Borough, United Kingdom. We thank you so much to both of you for sparing your precious time for us and making excellent presentation tonight, and thanks for your enlightening speech among us tonight. And once again, thank you for joining from abroad and making this webinar at international level. Thank you so much to both of you. To all our resource persons, your thoughts and lecture enlighten our minds. We are looking forward to your kind cooperation in the days ahead. So, thanks to our respected principal, Mr. Wan Sang Honsung, for his solid support and encouragement. He is always supportive, and our principal is not only giving us a moral support, he is always involved and take part in the webinar that have been conducted so far. We thank you so much to you, sir. Then I would specifically like to mention our technical team, Mr. Vandal Nakanamte and Silan Wakima, who have been the backbone of the event. we are fortunate enough to be backed by a team of very proactive and dedicated. And we can't thank enough to them for their willingness and tireless involvement for the success of this webinar. And finally, our sincere gratitude goes to all the participants, our students, alumni, students from other colleges, scholars, field practitioners, aspirants, dear colleagues. And we are also glad to mention that this time we have a wide variety of audiences joining from across the country, a well-known academician, teacher of colleges and universities in and outside the state. We thank you all for your active participation and support. We value that you are attending our program. And I'm sure that you get benefited and learn many new things from this webinar. At the same time, we are so sorry to hear that due to unpleasant weather tonight here in Mizoram especially, a number of aspirants could not join us our program tonight. And sorry to hear that. However, you are making this event success, and thanks to you all. And once again, credits goes to all the organizing board members, especially our chairperson, Dr. Grace Laldupi and Ms. Sai, and who have helped us making this event such a grand success. Last but not least, I must mention that we have been fortunate that God Almighty, who was over us and being a center of all of our program, we must thanks to God Almighty. And thank you, and God bless you all. Good night, everyone, and good day to some of you. And that's the end of our